The death toll from the Ebola outbreak in the Democratic Republic of Congo is continuing to climb, with concerns over the spread of the virus to other nations. Health officials say 204 people have died in 3 provinces in the DRC from 867 suspected cases. The outbreak is the biggest Africa has seen for a decade. The Red Cross says 3 Congolese volunteers have died in the Ituri province after apparently contracting Ebola there. The DRC government has suspended all flights to and from one of the epicenters of the northeastern city of Bunia to limit the risk of spreading the virus. The Transport Ministry says all humanitarian, medical or emergency flights must be assessed and require approval from health and aviation authorities. The Africa Centers for Disease Control has warned 10 countries are now at risk from the virus. Our global affairs correspondent Richard Kagowe is in Nairobi with the latest.
There's a lot of heightened surveillance that's being done within the East Africa region, where the Democratic Republic of Congo also lies, shares a border with about 9 countries. And what they're doing currently right now is having a joint coordinated effort in terms of mobilizing resources and also sharing, especially when it comes to medical supplies and also even just the technical expertise to deal in efforts to contain the outbreak itself. So the authorities in the Democratic Republic of Congo saying that the numbers have increased, and we listened to the Africa CDC director who indicated actually that the scale or the magnitude of the outbreak is huge, indicating that probably there are about 200 cases by the time that the outbreak was being declared. So there's a lot of surveillance taking place and heightened, sensitization that has been done by respective governments around, just engaging communities and also educating the public about the health crisis that's unfolding in Central Africa.
And Richard, health officials in the DRC have said that the response to the current outbreak is being hindered by the ongoing armed conflict with the M23 rebels holding some territory there in eastern Congo. But we also heard from M23 asking for help. So what's happening there?
Well, the M23 group, which controls some territory within North Kivu and South Kivu province, they have said that they're open to working with international partners. But the government in Kinshasa says it's very difficult, especially when you want to work and ensure that there's a joint coordinated response for the country, because they don't have access to certain territory that the rebels do continue to control. So what they're saying is that they're engaging not the group directly, but through their partners, the US and Qatar, who have been involved in mediation efforts. It's a bit difficult and challenging because when the M23 seized territory there, they replaced, the local bureaucracy, including the health ministry. A lot of medical aid workers were forced to leave. It's a bit challenging right now because for them and humanitarian organizations, they can't really find their way into the region simply because the logistics hubs, which is the main airport in Goma, was closed since January 2025 when the rebels took control. So that has really interrupted efforts perhaps to get the much needed medical supplies and also the personnel into the ground. And so the M23, which largely is seen as not being in a position perhaps to deal with an Ebola epidemic, which they've never dealt with before, has really raised concerns in terms of really getting access into this area. So at the moment, the M23 says they are open, but then of course the authorities in Kinshasa saying it's a little bit difficult. That's why they're pursuing diplomatic channels to help them sort of like get access for aid workers and health personnel in the region.